The term leaky gut is used everywhere online, but very few people truly understand what it means. Some think it is a trendy diagnosis. Others believe it explains every symptom they have. And many patients are left confused, scared, or convinced something is permanently broken inside them. As a doctor, I want to clarify what leaky gut actually is, what it is not, and why misunderstanding it often makes gut symptoms worse rather than better. Leaky gut is not an official medical diagnosis in most conventional settings. The medical term that comes closest is increased intestinal permeability. This describes a situation where the gut barrier becomes more permeable than it should be. To understand this, we first need to understand what the gut barrier actually does. Your gut is not just a tube for food. It is a highly selective barrier. Its job is to allow nutrients to pass into the bloodstream while keeping harmful substances out. This barrier is made up of several layers. There is a mucus layer that protects the gut lining. There are tightly connected cells that form a physical wall. There are immune cells that monitor what passes through. And there are gut bacteria that support this entire system. Under normal conditions, this barrier is flexible but controlled. It opens when it should and closes when it should. Nutrients are absorbed. Waste stays inside the gut. The immune system remains calm. This balance is what we want. Leaky gut refers to a situation where this balance is disrupted. The connections between gut cells become looser than normal. This allows substances that should stay inside the gut to pass into the bloodstream. These substances can include partially digested food particles, bacterial components, and inflammatory molecules. When this happens, the immune system notices. The immune system's job is to protect you. When it detects substances in the bloodstream that do not belong there, it responds. This response is not a mistake. It is a defense mechanism. The problem arises when this exposure becomes chronic. Chronic exposure leads to chronic immune activation. Over time, this can contribute to inflammation, food reactions, fatigue, joint pain, skin issues, and a general sense of being unwell. But it is important to understand that leaky gut is rarely the starting point. It is usually a downstream effect. The gut barrier does not suddenly become leaky without reason. It responds to signals. These signals can come from chronic stress, infections, repeated antibiotic use, poor sleep, ongoing inflammation, nutrient deficiencies, or persistent nervous system dysregulation. In other words, the gut barrier reflects the state of the system it lives in. One of the biggest misconceptions is that leaky gut is caused primarily by food. Food can play a role, but it is rarely the root cause. Many people become afraid of eating because they believe every meal is damaging their gut. This fear itself becomes a stressor, and stress directly affects gut permeability. The gut barrier is highly sensitive to stress hormones. When stress is chronic, the nervous system sends signals that reduce blood flow to the gut, alter immune function, and change how tightly gut cells are connected. Over time, this can increase permeability. This is one reason why gut symptoms often worsen during emotionally difficult periods, even when diet has not changed. Another misconception is that leaky gut means permanent damage. This is not true. The gut lining regenerates quickly. In healthy conditions, gut cells turn over every few days. This means the gut has a strong capacity to heal. The question is not whether healing is possible, but whether the environment allows healing to occur. If the nervous system remains in a constant state of threat, the gut barrier will struggle to restore itself. If inflammation remains high, the immune system stays activated. If the gut microbiome remains imbalanced, protective signals are reduced. Healing requires more than removing foods. It requires restoring regulation. Many people chase leaky gut by eliminating more and more foods. Gluten is removed, dairy is removed, sugar is removed, grains are removed. Eventually, the diet becomes extremely limited. While this may reduce symptoms temporarily, it often increases fragility over time. The gut becomes less resilient, not more. This happens because diversity matters. The gut barrier relies on signals from a diverse microbiome. Over-restriction can reduce microbial diversity, which weakens barrier support. In addition, fear-based eating keeps the nervous system activated. The gut does not heal well in a state of fear. Another issue is testing. Many tests claim to diagnose leaky gut directly. Most of these tests are indirect and not well standardized. They can create anxiety without providing clear guidance. A test result alone does not tell us why permeability increased or how to restore balance. Context matters more than numbers. In clinical practice, increased gut permeability is often associated with other patterns: chronic stress, poor sleep, repeated infections, hormonal changes, autoimmune tendencies, long-term digestive symptoms. Addressing permeability without addressing these factors is incomplete. It is also important to understand that some degree of permeability is normal. The gut is not meant to be sealed shut. It must allow nutrients to pass through. The problem is not permeability itself, but loss of regulation. Healing is about restoring intelligent control, not creating an impenetrable barrier. This perspective changes how we approach treatment. Instead of attacking the gut, we support it. Instead of forcing closure, we restore communication. Instead of focusing only on what to remove, we focus on what to restore. Restoring gut barrier function involves several layers. The nervous system must feel safe enough to allow digestion. The immune system must calm down. The microbiome must receive consistent, tolerable input. The gut lining must be nourished and protected. This happens gradually, not overnight. Sleep plays a major role. Poor sleep increases stress hormones and inflammation, both of which impair gut barrier integrity. Regular sleep rhythms support healing. So does consistent meal timing. Predictability helps the gut anticipate and prepare. Movement also matters. Gentle movement supports circulation and nervous system regulation. Excessive, intense exercise, especially when combined with undereating, can worsen gut permeability by increasing stress signals. It is also worth mentioning that not everyone with gut symptoms has significant permeability issues. Some people have motility problems. Others have hypersensitivity. Others have nervous system-driven symptoms. Labeling everything as leaky gut can oversimplify complex situations. Understanding leaky gut properly reduces fear. Fear worsens symptoms. Knowledge creates space for healing. When patients understand that their gut is responding to signals rather than failing, their relationship with their body changes. This shift alone can improve outcomes. Leaky gut is not a life sentence. It is not a personal failure. It is not proof that your body is broken. It is a sign that the system has been under strain, and systems can recover when the conditions change. In future videos, I will explain how chronic inflammation develops, why symptoms persist even after dietary changes, and how to support gut healing in a structured and realistic way. If you want doctor-led explanations that reduce fear and increase understanding, subscribe to this channel. Gut healing is not about sealing your gut shut. It is about restoring balance, safety, and communication. Thank you for watching.